Hi, thank you for taking the time to learn more about the kitten fostering through the County of Santa Clara Animal Services. My name is Dr. Elizabeth Cather. I'm one of the shelter veterinarians. I've been there for almost 5 years and have continued to see through that time of our foster program improving, taking feedback from you guys. So we found that one successful thing that other facilities have used is to do sort of an online orientation and training so that you can watch it at your leisure to get more information and see if it's something that you want to participate in. So we'll get started. This is about a 25-minute presentation, and any questions that you have after watching it, we'll give you the email information that you can contact us to get more information. Just a little bit more about our organization and what we do here. We're one of several local shelters in the South Bay area. This shelter itself has actually been around for over 40 years. And in probably the last, especially 5 to 10 years, I would say, the evolution of sheltering animals in general has shifted from what used to be called just the pound, where it was a negative place where animals were dumped and if they weren't adopted out were just simply euthanized, to now more of what we call a no-kill philosophy, where you try to not let time or space alter your decision, and every animal is looked at as an individual more. So focusing on things like enrichment and reaching out to the community, fostering, these are things that have become sort of mainstay in a lot of shelters across America, and we're happy to be part of that movement. And our new shelter that's currently being developed is going to significantly allow us to provide a lot more of a positive experience while these animals stay under our care while they're waiting for their forever home. So with our little shelter, you can see in these pictures, these are actually from our adoption room last year. We get over 800 kittens from all over the county, and most of these guys, when they come in, are too young and vulnerable to stay in that shelter while they're growing to be big enough to go to the adoption room. So this is where you as the foster are sort of mainstay in helping us to be able to save as many of these little guys as we can. A lot of them are brought in as orphans and really rely on a human and round-the-clock care that can provide them the care they need until they're that 7-week mark when they're returned for surgery and placed in the adoption room. What does the shelter provide for the foster kittens? We provide all the medical care during their stay with you. We provide food, supplies, and support. Our medical staff is here 7 days a week from 8 to 5, and you can reach us by either phone or email. And what do you, the foster caregiver, provide for these kitties? TLC, certainly, but also you're kind of our eyes and ears with all the medical and behavioral observations, certain personality traits. If you notice anything that's medically concerning, you are able to alert us. It's a much safer environment for these kitties to stay while they're growing up. Socialization is really important to make them more highly adoptable, and then transportation to their recheck appointments, which is going to be about every 2 weeks. So, although fostering is a very fun experience, it's also a commitment that you need to make sure that you're prepared to take on. You need to pet-proof your home. Isolation rooms are great, or a cordoned off area. You've got to block hiding spots. These little guys can get into small spaces. We recommend that you separate your own pets, especially for that first 2 weeks that they're in your home, and then make sure that your pets are all up to date on their vaccines. And also prepare to get attached. We have a joke calling it a foster failure when the foster ends up adopting their fosters, which is great. But our long-term goal is to find a new forever home for them so that you can continue to foster through the season. So what we do before we give you a call to send you a group of foster kittens is these kittens come from all over the county. They come from members of the public. They come from our animal control officers. As soon as they come to our facility, they are impounded and screened for common conditions that we see every year, including upper respiratory infections, parasites, and ringworm. Age-appropriate vaccinations and flea treatments are provided, as well as deworming, before they're sent to their foster home. Now, having said that, we want you to be aware that even with our screening process, some contagious conditions, such as ringworm, may not be detected prior to the start of their fostering. We can't guarantee the health of any foster animals. The incubation period of some of these diseases can be as much as 2 weeks. So that's why you're the eyes and ears to let us know if you do see anything that's concerning that we can address when they're in your home. Just a little bit more information about the supplies that we'll be providing for you during your foster period. A lot of the things we'll give you are easy to disinfect, and we ask that you return them to the shelter when you're done fostering so that we can reuse them and send them out to another foster home. We will provide you with disposable litter boxes and litter. We use something called Yesterday's News, which is a non-clumping litter for the kittens of this age. If you don't have that separate room, like I mentioned, we can provide you with a playpen so you can keep them more confined, especially that first 2-week period. We'll give you a plastic carrier to bring them to and from their appointments. If you're taking on bottle babies, we'll supply several bottles as well as different nipples and the powdered formula. Older kittens will get both wet and dry food. Also your paperwork, and if you take on any kitties that are on medications, we'll provide those as well. So if after watching this presentation, or if you fostered for us before and know you want to do it again this year, we've created a new sign up, and once you're ready, you're what we'll call on deck. So you're on board. That means you're ready to accept kittens when they come in. On that website, you'll submit a little survey designating the age groups, how many kittens you feel comfortable. Also, if you're willing to take on kitties that come in with certain diseases like ringworm and upper respiratory. Once you finish that and you let us know when you're available and what you're willing to take on, then that means you're up next. And once we get kitties in, we'll give you a call. And if you're not able to come pick them up that day, then we can try to arrange transport so that we can drop them off to you. This way we minimize how long they stay in the shelter. Ideally, we want them to go out the exact same day that they come in so that they're not exposed to any potential other infectious diseases. So a little more about the quarantine period. We strongly recommend it for the first 2 weeks. As we mentioned before, if you have a spare bathroom or bedroom, that's great. Ideally, you want something that's easy to disinfect, warm, quiet. If that you're not able to provide a separate room or sectioned off area, then we do have playpens that you can create a little quarantine area for them to stay in during that time. So part of the job of being a foster is to monitor these kitties daily. You should keep a log of their appetite, their urination and defecation, any behavior notes. If you see anything concerning like vomiting, sneezing, eye discharge, we will provide you with a sheet that you can keep notes. Any concerns that you see medically, you can certainly direct to the staff by phone or email. The contact info is listed under there. That will also be provided in your handout that you receive. So this big grid here, it's a lot of words. It'll be provided online as well. It just gives you kind of an idea of what to expect from birth when these guys just come in with their eyes and ears closed and mostly just sleep, to the point where they're 6-7 weeks and getting ready to be dropped off for their adoption. So it just gives you sort of the milestones to look for in their development. These aren't hard fast. Certainly some kittens develop more slowly, some more rapidly, especially with weight gain. But this is just a good rough estimate of what you should expect to see. So I just wanted to mention, and it's one of the sad facts of any orphan kitten project, is mortality rates. Sometimes these kittens become ill and they pass away in the foster home. There are lots of studies suggesting that the pre-weaning mortality can be up to 30% or more. There's actually a term called fading kitten syndrome that leaves us with no why this kitten didn't make it. We certainly try to do everything we can to save every single kitten, but there are cases when an animal requires medical treatment that goes beyond our ability to humanely provide. And we take the decision to euthanize any kitten very seriously. We don't ever euthanize due to lack of space or time. The kitties that come in with their mommy tend to have higher survival rates. So we certainly try to, when kittens come in, actively have people go out and see if they can trap the mommy kitty so that we can reunite them. So as I mentioned, when you sign up on our website to be a foster, one of the questions we'll ask you is the age groups that you're comfortable with. The first age group, and this is certainly the most challenging, are what we call bottle babies. So these are the orphan kitties that come in between 0 and 3 weeks old without a mom. These kittens are the most vulnerable. We get them in as early as just a few days old. When they're this age, you need to be really careful in keeping them warm. They're not able to thermoregulate, so we send little warming discs to keep them nice and cozy. These guys are on formula. We use something called KMR, which is a kitten milk replacer. We provide you with enough to get you through this period. You just mix it with water. We don't ever recommend giving cow's milk to these guys. On average, these kitties eat about 2 tablespoons or 30 mils per ounce of body weight within a 24-hour period. So basically, if they're really young, less than 2 weeks, they're going to be eating every 2 hours. So you take the amount of feedings in a 24-hour period, so that would be 12, and you're going to divide the total amount in that day that they should get by 12, and that's on average about how much each feeding that they should be consuming. Once they get to 2 to 4 weeks, then you can back down to feeding them every 3 to 4 hours. If they're sleeping through the night, we don't recommend you need to wake them to feed them. They'll certainly let you know when they're ready to eat. If you've got multiples in the litter, you want to always feed the weak ones or the ones that aren't eating enough more frequently, and also you want to feed those guys first. And one more challenging thing about this age group, these little orphan bottle babies, is that they need to be stimulated to eliminate. Usually the mom cat takes care of that, but we as the foster need to just rub their little abdomen and their anogenital region with a cotton ball, or you can use a fragrance-free baby wipe. They should urinate during each stimulation, and they'll defecate probably about once a day. Once they get to that 3-week mark, then you can offer them a shallow litter pan with a small amount of the non-clumping litter that we provide. So the next age group is what we call transitioning kittens. So these are kitties that are coming off formula and starting to learn how to eat solid foods. So during that transition, you want to start them with a gruel. So you can mix the canned food we provide with either warm water, or you can mix it with some of the formula. You may have to hand feed, put flat serving dishes, warming the food, try to encourage them. This is a new texture for them, so some of them pick up on it really quickly and others need a little extra help. You may have to syringe feed just to get them used to the consistency of the food. You do at this age want to leave dry food and water out. Some of them will take to the dry food right away, but we always want to have it there as an option. So the next age group that we differentiate when you sign up to be a foster are what we call self-feeding kittens. These are kittens that are generally between 5 to 8 weeks of age. They're eating dry and wet food and water on their own. We recommend you feed them about 3 times a day with the canned food. They're gaining weight really well, and at this age there's just a lot of playtime and fun interactions and lots of socialization. So this is probably an age group, if you've never fostered before, it's one that you'd want to start with. It's a short-term foster, so generally they're only going to be in your home for 2 to 3 weeks, and it's usually a positive experience with lots of playtime with rambunctious little kittens. And to touch a little bit more about socialization, so there's a critical window that we see between 2 and 7 weeks of age. These young kitties that come in are often really under-socialized. We get a lot of little ones that have really never had human contact, and they come from a colony where human contact is not the norm as well. So we get ones that are scared, sometimes they're hissing. So we recommend you do a lot of short socialization sessions on a daily basis. We don't ever want to encourage biting behavior. Make sure the kitty's comfortable. Freezing or submission is a sign that they're scared, so you just want to go more slowly. If they have a litter mate, that's usually the best. Other cats teach them how to behave. When we get in single kittens, depending on the age and the health of them, we will sometimes find another single kitten to pair them with so that they're not by themselves. And the last group that we often get in are a mom kitty with her kittens, whether they come in together or if we've had success when orphans come in that we've trapped mom to reunite them. The benefit of having a mommy kitten and her kittens is that there's little to no bottle feeding. Mom takes care of all of it. There's no need for you to stimulate to eliminate. Again, mom takes care of all of that. And mother's milk, as we discussed earlier, is ideal for the health and the immune system of these guys.
We do get friendly mom kitties that are handleable, and we also get some feral ones that are very unsocialized. So for the feral kitties, we recommend a more experienced foster, so that you know how to interact and monitor the kittens while they're still with their mother. Once these kitties are consistently eating solid food, usually about 4 to 5 weeks of age, then the mom kitty is returned to the shelter for surgery, and she's either placed in our adoptions room or she's returned to her colony. Okay, so moving on to some of the common diseases, just to go to a little more depth of what we see every year. Upper respiratory infections is probably one of the most common things we battle. We also see ringworm, diarrhea, which is a lot of times dietary related, and less commonly, but still every year, we do see cases of feline panleukopenia. So a little bit more about upper respiratory infections. It's similar to humans where there's generally a viral component that starts it off, but they get secondary bacterial infections very commonly as well. Common symptoms you'll see is ocular discharge. It could be clear or thick yellow-green from their eyes and or their nose. Decreased appetite, usually because they can't smell as well. More depressed. They could sound very congested, sneezing, coughing, sometimes a fever. We recommend if you see these signs to first give it a day or two with just rest time. You can clean the eye and nose discharge with warm washcloth. You can use compress. Humidifying works really well. Stick them in a steamy bathroom and shut the door, and that helps loosen some of those thicker secretions. If after a couple days you're not seeing any resolution or you're seeing them worsen, then certainly contact us. Those kitties might be ones that are candidates to actually go on oral antibiotics or antibiotic eye treatments. So the next disease that we see less commonly than upper respiratories, thankfully, is ringworm. A lot of you have heard the term and are familiar with it. It's really not as scary as it sounds. It is a zoonotic fungal infection, meaning that it can be transmitted to people. It causes hair loss, crustiness, and redness of the skin on these kitties. And transmission is primarily through direct contact with the animal. But the fungus is adhered to their hair, and so that can be shed and spread that way as well. Treatment usually is a combination of both topical and oral that's used to clear it as fast as possible. This is considered technically a self-limiting disease, but because we want to get these kitties cured and available for adoption, we try to speed up that resolution. So the typical length we see is about 6 to 8 weeks. The cleaning and disinfecting should include removing the spores, so vacuuming anything you can, washing bedding or contaminated objects. There's a lot of over-the-counter disinfectants that are safe around the kitties, including Fantastic, Formula 409, Simple Green. We here use something called Acceler Rescue, which is an accelerated hydrogen peroxide, and we're happy to provide that as well. Sadly, these are the kittens that it's hard to find fosters that will take this on just because of that risk of transmission. And these are the kitties that end up staying in the shelter during that entire 2-month period. So if it's something that you're interested in learning more about and you're not sure, then certainly contact us. But we tend to see that they resolve faster in a foster home than they do sitting in the shelter.
Another condition that we see quite frequently every year is diarrhea. It's kind of to be expected in a lot of these kitties. These orphan kittens, especially the age group that's transitioning to soft food, can develop a transient diarrhea, so just for a few days. All our kittens are dewormed at 2 weeks, and this year we're preemptively deworming every kitty at 2 weeks for another parasite called coccidia so that we can eliminate that as a potential cause. Um, we just don't have the time or resources to perform fecals for every kitty, so a lot of shelters just now are turning to preemptively deworming against all these common parasites. If the kitties are over 4 weeks, we recommend first trying to just decrease the amount of canned food that you're feeding, and you can add Metamucil, about a quarter teaspoon per day per kitten, and see if that starts to form the stool. If you notice that after a couple days the diarrhea is persistent, or if you see that they're more lethargic, or of course if you see any blood, then definitely give us a call or an email. And again, the number and email are provided there. And I just wanted to briefly touch on panleukopenia. This is something that most of you aren't ever going to deal with. This is a fatal viral disease that kitties can get, and it's one of the things that we are vaccinating against. However, vaccines aren't fully effective until they're over 4 months of age, similar to infants that get boosters. This virus is also sometimes called the feline distemper virus, although it's actually more closely related to the canine parvovirus. And what it does is it attacks the cells of their gastrointestinal system, but it also wipes out their immune system, making them more prone to all sorts of secondary diseases. Clinical signs, unlike parvo, we often just see that they're lethargic, they're hanging their head over the water bowl, they're not gaining weight. There's a pretty high mortality associated with this disease. However, the last couple of years, we've had more and more experienced foster homes that we've been able to get these kittens out, and we've seen a much, much higher survival rate in litters that have this disease. So this is something that more experienced foster homes are probably going to be taking on, but I just wanted to touch base on it. So another thing that you as the foster are going to provide is transportation to their follow-up appointments. So every 2 weeks, your kittens are going to need a physical exam, a weight check. You can also be doing this at home. It's certainly a good idea to monitor their weight, but we'll do it when they come for their appointment. And then every 2 weeks, age appropriate, of course, they'll get another vaccine booster with that FERCP, and then another dewormer. Once these kitties weigh in at 1 pound 8 ounce, they're actually ready for surgery and adoption. Usually that's about 7 to 8 weeks of age. Some of them sort of take a little longer to get to that weight, but this is the most highly adoptable age, so we want to get them fixed and available to the public so that they can get their forever home. And just again, the stuff that we provide, so we provide all the medical care that you're going to need when these kittens are in your care. Any medical questions or concerns, you can call us at that 686-3903. Like I said, we're here between 8 and 5, 7 days a week, the medical team. You can also email us. We all have access to that email, so you'll get a response within a day. Your foster guide that we hand you will give you more detailed information about symptoms when you need to contact us. If an emergency comes up and you cannot reach the medical team, especially if it's after hours, you can always contact the shelter supervisor, Jeremy Selbach, at that number, and he'll help you decide if your kitten needs to be seen at one of our outside contracted clinics. We have contracts with some emergency clinics that, if needed, you can take your kitty there. But you have to get pre-approval from the shelter supervisor before you go. We do not want you going to your own veterinarian, as these are the county's kittens, and we want to make sure that we keep track of their medical care that's provided. So the end of your foster period, when you're going to return these kitties to the shelter, like I said, it's generally once they're over 1 pound 8 ounces or about 6 to 7 weeks of age. They certainly can go in our adoption room after their surgery to await their forever home. However, as we peak in our kitten season, which generally is July, August, September, our supply and demand, so to speak, become more discordant. We get way more kitties back from foster and coming in than we can possibly adopt out. So that's why we really encourage you to be what we call an adoption ambassador. This means that you also are proactive in finding a home for your fosters within your network of friends, family, your neighborhood, acquaintances. We have one foster that every year she's done it, every litter, she has found a home for every single kitten. So they've never had to actually stay in our adoption room. The benefit of this is that they can leave for their forever home the same day they're returned to the shelter for surgery. That way they're not at increased risk of getting infectious diseases, which can then delay their adoption even more. Okay, so if you think that you're ready to sign up, I'm just going to have a few screenshots in the next few slides to walk you through navigating the website and where to click. So when you go to our homepage, which is that sccountypets.org, you're going to see our main website, and you want to click where it says foster, right where that arrow is showing you here on this picture. That's going to take you to this foster care. It's just another brief description about kitten fostering. And then you're going to click again where it says sign up today. And that's going to take you to this opportunity search where it should bring up the foster options. And once again, you'll click right there on kitten foster. And one more time, you're going to click now where it says sign up. If you already have an account, then it's going to ask you just to log in. If this is your first time signing up for a volunteer opportunity through the county, then you're going to be asked to create your own account. And this is what it's going to look like if you're signing up for the first time. So you're going to create your own user ID and password. And remember this because by doing this, you're actually creating your own sort of volunteer account. And in this, you can go in and change if your availability changes. If you're all of a sudden not available, you can go ahead and change that under your settings. And also all those questions that we ask you. So say you decide, hey, maybe I do want to try and take on some ringworm kittens. You can go and change that in your profile as well so that lets us know. And this is sort of what it will look like as you get through the questionnaire. So again, like I said, those dates and then how you heard about us, which helps with our recruitment process. And then the next questions will be all about selecting what you're comfortable taking on so that we can pair you with something that you have selected once that group of kittens comes in. Well, once again, thank you so much for your time and interest in learning more about fostering kittens through the County of Santa Clara. If you have any questions about the presentation or fostering in general, you can just email us at that scc.animalfoster@cep.sccgov.org. If you're interested and you're ready to sign up, then please go to our website, that SC County Pets, and follow all those links that we showed you in the previous slides. Once you're signed up and if you say you are available, you could expect us to be contacting you any day once a group of kittens comes in that matches the age and selections that you opted in. And as we said before, if you're unable to come down to get kittens that day, we could potentially arrange transport to your home so that they can leave the same day that they come in. All right, thanks so much.